So I'm going to use an example, trying to keep things relevant this afternoon, and think about places where there are people living who have chronic conditions that potentially make them more vulnerable to the current pandemic that we're dealing with. And what the CDC has told us is that there are a number of chronic conditions that worry them, because people that have these chronic conditions, were they to get the virus, they're going to have a harder time fighting it off. So I'm going to look for diabetes. And here we have the estimated percent of adults ever diagnosed with diabetes. And I'm going to add that to the map. And once that loads, I'm going to set a filter and say, I just want to see those places where more than 10% of people have diabetes. So you can see now fewer places are shaded. So this is the combo here is they make less than $35,000 and more than 10% of the population has diabetes. Another risk that we've been hearing about is asthma. And I can look at the estimated percent of adults who are reported to have asthma. And as that loads, I can similarly think, I'd like to see maybe we're 15%. That's a little high. Maybe we're 10% or more of people have asthma. So now these are all three conditions being met, and this is as far as you'd be able to go in current PolicyMap. But with the new platform, I can add on 2 more indicators. So we may want to see, for example, are these people living in medically underserved areas? Medically underserved area, meaning it's an area that does not have access to primary care doctors. And so if folks in these areas get sick, they are likely going to have to go to a hospital. So this is something that hospitals may need to be aware of. So here I'm going to click off, not a medically underserved area. So I'm just looking at places that are designated as medically underserved areas. These are places, as I said, that do not have access to primary care doctors. And perhaps food, grocery store access, access to everything from food to cleaning supplies to vitamins to medicines. So we want to see where people are do not have good access to a full grocery store. And here I will click off not LSA. So as you can see, fewer places are on the map. But in terms of strategically thinking about places that may need a set of interventions in a time of crisis, these are places which are lower income, have higher rates where 2 chronic conditions are met, they're medically underserved, and they don't have great access to a full grocery store. So if we wanted to add hospitals, for example, we could do that. And again, we can change this to red and make these larger. And we could load grocery stores. And again, we could turn these into circles and keep them orange. So you can now zoom in and see in these areas where there's not a hospital nearby, and there are some supermarkets. And so thinking about, and if we filter this, by the way, so we're only looking at full service, we'll get rid of corner stores, the number really goes down drastically. So, as public health, thinking about how these hospitals are going to handle some of the patients coming from here, what kind of preventative actions could we be taking now to help make sure that these people are safe and cared for as things progress. Those are just some hypothetical examples of how you could use PolicyMap and this new tool to better understand these kinds of things.